Welcome. I'm Carolyn Lowell with OrthoWorld. Joining me today is Lincotek CEO Winfried Schaller. While contending with COVID-19, Lincotek has promoted a new brand, expanded its facilities, and integrated its CoorsTek acquisition. Today, we plan to discuss what Lincotek is hearing from its OEM customers, how the company has responded to COVID-19, and lessons in balancing responding to a pandemic and maintaining planned investments. Winfried, thank you for speaking with me today.
Hello, Caroline. Thanks for having me.
What are you hearing from orthopedic device customers today?
What we see that today, we have OEMs, perhaps the larger ones, that had a very good cash balance. They went on kind of with their program. They were still very active in terms of requests to us. We see, on the other hand, some mid-tier players, perhaps a lot of startups, that are getting a little bit of a cash problem. So they can't ramp up their inventory that much. So they might start to be really very, very reactive. So I think we see kind of a little bit of an issue there in the market. I think what we hear is that to the biggest extent, everybody is expecting that the markets will be coming back by Q4. It might be beginning of Q1, but looking at our type of product that we are making, it should be somewhere around Q4. If not, what we see globally is the aspect of unemployment might have an impact. But on the other hand, we have people that also need us. So I think there will be an impact from kind of the general economic conditions, but there will be a normalization, and I would expect towards Q4 that we see a kind of a recovery. Other things we see that our customers really focus a lot on their supply chain, so they might push out new projects a little bit further out. So it might be that the real R&D activity or new project for launch is now postponed by a year or by half a year, because they just didn't want to go into this hot COVID period with a new launch where everybody was focused on something else. So we see this kind of trend. In the especially engineering field, we have a big engineering department in-house. We see that some projects really get seriously postponed, and we are discussing with customers how to deal with that. So we are trying to help our customers to find creative solutions, not to compromise the future because of the actual situation. So I would say in that respect, we see some issues on that side, but we try to manage together with the customer through this period in that respect.
Your acquisition of CoorsTek has certainly been noteworthy in the industry. It helped the company transform into a full-service contract manufacturer. And OrthoWorld's Orthopedic Industry Annual Report, we labeled you a contract manufacturer to watch. What progress have you made with the acquisition over the last 12 months?
Yeah. First of all, thank you, Caroline, for the compliment to be a contract manufacturer to watch. I think it's really true. You see, in the first 12 months after the acquisition, we called that phase one. We focused on getting the basics right, understanding the business, understanding our colleagues, how we work together, trying to figure out how we can create an even more seamless and integrated service for our customers. If we look at our Portland facility, we have now made significant investments there. We invested in sort of now in the validation phase in a state-of-the-art finishing line. So effectively, we are coming from the casting and we are having in the same facility state-of-the-art finishing. So this is not complex anymore. Our customers order and they get a finished product. They don't need to manage different players in the supply chain. Then we have invested a lot in our kit that we have, especially in the machining area. So in our plants in Dayton and Logan, we upgraded the machine park in the last months, because obviously, we went through a process of understanding, a process of developing our CapEx plan, and then a process of investment. And effectively, a lot of the machines arrived just in the COVID period, in the hot COVID period. I would say CapEx, a lot of CapEx that we put into that acquisition. And there will be more, because our decision was to ramp up the machine park over the coming years. So I think it's just a start. We invested a lot of time, and that's what we did effectively immediately in terms of lean management, optimizing the shop floor activities.
Also, during this time, you've continued to make investments to expand your facilities in China and Italy. Can you talk a little bit specifically about what actions you've taken there?
So in China, we effectively doubled our coatings capacity. So we installed a brand new equipment, coatings equipment that is coming out of, we are producing our own coatings equipment. It's proprietary coatings equipment. Very, very high-tech equipment. So we doubled our capacity in China in terms of coating, and we installed a state-of-the-art, world-class cleaning and packaging facility. We were able, with this investment now, we have two of this state-of-the-art equipment in Europe, two in China, and two in the US. Top end and very, very nice, produced by ourselves, proprietary technology. So then, we invested a lot as well in our Italian facility in Bologna. You know, before we acquired from CoorsTek, the CoorsTek business in the US, we acquired the business in Europe, in Bologna. That was about 1.5 years ago. So that business, we focused a lot on shop floor optimization, getting everything right, the way we think it should be, together with a local team. And now we also put in a new investment. So we have a very, very nice state-of-the-art multitasking equipment that we have installed there that is effectively capable of addressing all the machining steps for certain applications. So very, very nice. And we see that our activity in Bologna is very well received by our customers. So similar to what we do in the US. So we will offer to our customers in the US and in Europe fully integrated supply chains. So Bologna, also this one we're just finishing up recently. We invested a lot in our additive activities. You might know that Lincotek is probably in the orthopedic device industry the biggest contract manufacturer in the world. We are producing about 100,000 or more than 100,000 devices a year. And our success, our value proposition is really very profound technical know-how that we have. In terms of production, but also in terms of validations. So we are very close to our customers, helping them to validate additive-produced medical devices. And also here we invested a lot in our Italian facility. So it's now, we have there a facility which you don't find many in the world. And we kind of finished the major part of the investment just with the last installment of a new high vacuum furnace and a validated heat treatment process and lab. So that is, you have in one facility there, you have everything you want to have from an additive manufacturing perspective. So also here, that was very important for us to close that investment up this year. And now kind of last but not least, we also installed 2 new lines, coating lines in Trento, also for the European market. These are not the ones that I mentioned before. These are 2 APS lines, and they will serve us well and give us a capacity. So with all these investments, if I want to round that up, you know, that's an important part to give us a flexibility that I was telling you on the pillars for our customers, because we have the capacity. You know, we can address the ups and downs in the market with all this capacity. So
what lessons have you learned from COVID-19 that you think are important to share with others in orthopedics?
Flexibility and reactivity is kind of a key. You know, we are a manufacturing environment by nature. You know? Manufacturing environment needs planning and, I have to sequence the things in the right way to be efficient. But we had to bring in a bit more flexibility into this and a bit more reactivity to the real needs. So kind of your planning changes a little bit from a kind of longer term to I plan on site. I can only plan to what I see. So this kind of needs a different flexibility, and we try to realize this with our CapEx investment program and with our people. I think second point for us, which was also very important, was a harmonized global organization with best practices that were adjusted to local needs. Why could we react so fast to COVID? Because we kind of understood global best practice. But there was different situations in the different plants, so in the different areas, in the different regions. So they adapted that to the local situation. So I think that was for us a big success factor, very important learning there. That helps. That is a success factor for us. And I would say for us, a third point is the high level of standardization that we have. For example, in the coating segment. So we have the same kit produced by us with the latest IT setup that you can have globally installed. So we can offer risk mitigation to our customers all over the place very fast. We can move if needed relatively fast. Our limiting factor only the validations.
You have certainly accomplished a lot in 2020, along with your, the response to COVID. Do you have any final comments that you would like to share?
Yes, some.
Okay, please.
So I think one thing, and this is probably more soft, learning the human factor. I think in the COVID-19 made our working relations more human. Yeah? Sort of, it showed we are more dependent on each other. And I'm not talking about the OEMs alone. I'm talking also about the patient. We are all very important. And somehow there was more respect in the chain, one way or another. It became a little bit more human, I have to say. And because at the end, we understood we are all in the same boat. Yeah? And I think that for me was an interesting aspect. Another one, which I thought was also interesting, and there we have to work on as organizations. We were talking a lot about home working, and that's where we go, but it has its limit. I think it's more about smart working in the future. So how do we integrate that? Things have changed. As I said at the beginning, there was a before and there's an after. We would most likely travel less. So we have to work smarter. We know there is a limit to create new business just by phone. That's not easy. So we have to find mechanisms in terms of how can we integrate. And I'm sure they will be coming because our new now is there. And so smart working is something that we have to address as an organization. So that's another point. And then, I think, looking forward, the second half of 2020 will be very interesting. So we have a lot of lessons learned. I think the biggest lesson probably that we learned is we can confront a lot of difficult issues. So all of us should work with confidence and trust. And I'm sure we will manage also the second half, which will have its own difficulties, which I don't know exactly what it's going to be. We will manage that very well. And with that in mind, I think we will, as an orthopedic device supply chain, will get out of the crisis much stronger. That's my profound belief. We will get much stronger as a supply chain getting out of the crisis. We will have learned our lessons, perhaps a little bit more of a human factor, good smart working, and applying the lessons that we learned. And we will be very successful.
Thank you so much for your time today, and certainly look forward to hearing more about what is in store for Lincotek.
Great. Thank you very much to you, Caroline, and your team from AutoWorld for giving me the opportunity to speak to this large audience, and all the best to everybody. Thank you.